I'm Dr. Eva Njenga, physician endocrinologist, here with Ponea to talk about thyroid disorders. The hypothyroidism was to come in a baby or in utero. The babies are born underdeveloped, both mentally, the brain development, and even structurally. So we get babies that are called cretins. If you check babies that look like dwarfs, because even structurally they are not developed, and also very slow. So these are people who are insulted in school. These kids suffer trauma and stigma, and the parents have no idea. So this is something that really needs to be diagnosed early, and I will talk about maybe how to diagnose this early. So maybe I go to the other type of presentation. What if the thyroid hormone is overworking? And we do see a few, quite a number of them. It's not many, but they are there. When the thyroid just decides to overwork, that excess hormone now, it's like you are on the gear number 5, moving very fast, all right? Everything is moving fast, including your brain function, even your cells. So you have excessive heat intolerance, then you are sweating a lot, then you lose weight even if you're eating. You could eat excess food compared to everybody else, but you're the only one who will continue losing weight, so people don't understand. Then, of course, what else happens? You are overthinking. Your brain is on the high, so you feel like everybody else is very slow, so you become very irritable at everybody. Everybody seems not to be doing things right, because for you, your brain is at a very high level of performance. Then, of course, the other thing is that you sweat. Remember the low thyroid was dry skin. This one is you are sweating all the time, so you find that somebody is sweating, and then because of that hyperfunction, sometimes you also find that patients are tremoring. They have tremors. They are shaking. Both, they might just be there and very restless. So that's now the overfunction. There's another one. There's another thing you might notice on the patient. They might still also have a swollen or enlarged gland, which even a nodule. That is the one that is overfunctioning. And thing that can happen when the thyroid is really overfunctioning and is a class of thyroid called Graves' disease. They come with prominent eyes. So I don't know whether you have seen women who sometimes look like, even men, but men are very few, they are staring at you all the time, or the eyes are almost popping out. In the very severest forms, the eyeball sometimes actually pops out, and the cornea gets destroyed. So we've seen such cases whereby they have to go for eye surgery and have maybe even the decompression, whatever is pushing the eyeball out. So these are the kind of the excess. Then, because of that increased thyroid hormone, there is an increase of the performance of what we call the adrenaline in your body. So your heartbeat is racing like crazy. So the patient will say, I can actually feel my heart beating. So we call that palpitations. Some of them sometimes come with an increased blood pressure, especially what we call the systolic, but not always. All right. Then the other thing that you need to realize about both the thyroid disorders, they are more common in women. If you have 10 cases of thyroid disorders today, 9 will be women and only 1 will be a man. So this is very, very important for people. So women, that's why I keep on giving examples of women. They need to be the ones to be screened early, even in pregnancy and so forth. And of course, the other thing is that we talked about the excess menstrual flow. In over-functioning thyroid, sometimes the periods can even disappear for months. And when they come, they are very scanty. So those are we are trying to create awareness. We are not going to the very deep medical issues or presentation of the thyroid disorders. I would like first to thank all of you, the Ponea team, and also thank anybody who is listening to this, wherever you are, whether you are a patient or not, to take this information, make yourself empowered to learn about this condition. Should you think that you have something in regard to this, it's important you can go on Ponea platforms. There's an app for patients. You can get the information where you can get more guided as to where to book to health professionals that deal with this. We have the specialists, endocrinologists, both for adults and for children as well. And we also have physicians who really also will be able to guide you, investigate you, and treat you or refer you to the correct specialists.